To the coronavirus emergency, an alarming rise in cases as the Delta variant sweeps through the country. Hospitals are saying patients are coming in younger and sicker. Whit Johnson joins us with more on all of that. Good morning, Whit.
Amy, good morning to you. New York City, once the epicenter of the pandemic, has made a remarkable recovery, but cases here have more than doubled in the last week, fueled by the Delta variant. And across the country, the CDC is now predicting an increase in hospital admissions over the next month.
This morning, the highly contagious Delta variant gripping the nation. Positive COVID cases across the country rising nearly 87% since mid-June. In Los Angeles, cases are up 500% over the past month. Cedars-Sinai Hospital reporting a 7-fold increase in COVID hospitalizations in 2 weeks. Health officials say the majority of those patients are unvaccinated 20 to 40-year-olds. The rapid rise of the Delta variant now putting an urgent focus on children, those under 12 still not eligible for a vaccine. Health officials in Utah, where there are no mandatory COVID protocols in place, saying they investigated outbreaks at 10 different summer camps in 1 week.
It's just perhaps a glimpse of what's really of what's to come for the school year, which if that's the case, it's quite concerning.
7 children in Mississippi are being treated in ICUs, including one younger than a year old, 2 of the children on ventilators. Health experts say they are seeing more severe symptoms in children who test positive for the Delta variant.
I suspect that's probably because this Delta variant is imparting a little more severe illness in the pediatric population than those earlier strains that were circulating.
But for one family in Arkansas, a hopeful development. 13-year-old Kaya, hospitalized with COVID, is getting taken off a ventilator.
I have not heard my baby's voice since July 3rd at 6:30 in the morning, so I am very excited to hear her say hi, Mom.
And back here in New York City, health officials say more than 98% of those who were hospitalized or died from COVID this year were not fully vaccinated. Michael?
All right, thank you, Whit. Joining us now is the director of the CDC, Dr. Rochelle Walensky. Dr. Walensky, thank you for joining us this morning. And we're getting reports of younger people now being hospitalized with COVID. Are children more vulnerable to getting severely ill from the Delta variant, and how bad are their symptoms?
Good morning, Michael. I think what we recognize is that people who are unvaccinated are more likely to get severe symptoms and end up in the hospital. And what we're seeing now is that children are now more likely to be unvaccinated. So the lower age you are, the less likely you've been vaccinated. We know that our 12 to 17-year-olds, only about 30% of them are vaccinated across the country, whereas our greater than 65-year-olds, over 80% of them are vaccinated across the country. So what we're seeing is that people are coming into the hospital when they're unvaccinated.
And in some parts of the country, the fall semester, speaking of the younger kids, the fall semester school is set to start next month. With younger kids being unable to receive a vaccine, and with this surge that's happening in unvaccinated people, is it safe to send them back to school?
What I can tell you about how you can keep them safe. And so, yes, first of all, we want our schools to be open. We believe our schools can safely be open, but we still have to practice the mitigation measures that keep them safe as we open those schools, which is so very important in the fall ahead and what the schools that they've missed over the last year and a half. How do we do that? We vaccinate our families so that our younger kids are not at risk, because by vaccinating your teenagers and adults in the household, you protect your young children from being at risk. And then when they go back to school, to have them wear masks, to practice the mitigation measures that we have been talking about. And by doing so, we believe our kids can be safely back at school. Many of the outbreaks that we're investigating now, that we're working with states to investigate now, are a result of not practicing those prevention measures.
Nearly every state in the country is reporting a rise in new cases. Chicago, they've reinstated travel restrictions for unvaccinated travelers. If this trend that we're seeing right now keeps up, do you anticipate more cities and states doing the same as Chicago's doing?
I think that may be the case, but I think now is our moment to really double down on our vaccination efforts and our other prevention interventions. We still have to send the same messages as we did last year. If you have upper respiratory symptoms, symptoms of COVID, please go get a test. Those tests are available. If you think you have symptoms and you haven't had a negative test yet, please stay home, quarantine. Do not expose yourself to others. Wear a mask. All of the same prevention measures. And of course, this year we have the best tool, that is go get vaccinated.
And we all know in about a week, the Olympics are going to start in Tokyo, and they're reporting the highest number of COVID cases in almost 6 months. Is it safe for the games to proceed even though there won't be fans?
Right. So they have deployed measures, prevention measures within the Olympic Stadium and the Olympic Games to try and keep their athletes and the viewers safe. And so would defer to the Tokyo Games for all of the prevention measures that I know that they're putting in place, including vaccination as well as testing and other quarantine measures.
Dr. Walensky, thank you so much. We always appreciate your input.
Thanks so much for having me.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.